Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Oh, yeah. Well, let me introduce Dr. Coleman. Dr. Coleman is assistant professor of surgery at Howard University and is the interim chief of urology, the division of urology, and has been in the practice of urology now for, how was it, 25? No, it's 30 years now.
Yeah, since 1986. So you have to
Yeah,
do the math.
yeah. It's been a good while. Yeah, and so she is very proficient and has been dealing with men and women with urological diseases. And therefore, she's going to share once again her expertise with us. She's one of the few who's been speaking to us since the days of before the pandemic in person, and now again she's here with us in Zoom. So, Dr. Coleman, the floor is yours for the next hour.
Thank you so much, Dr. Callender. So good morning, everyone, and I'm glad you can hear me and see me. Sorry for that little bit of delay. So I'm going to talk about erectile dysfunction, and we're going to go through. I have on my desk here a lot of different treatment options and different things, but I want to start first thing that it's a very, very common problem in both men and women, okay? And we're going to talk about both men and women. It can be treated, okay? So don't fear. It's something that happens to everyone at actually different stages of life. We see it, I see it in my practice as early as people are actually in their teens, but even probably more commonly after people get over 40. And there are a lot of causes. We used to think that it was more psychological, but now we're finding that it really starts as more of organic causes. So it may be associated with different drugs that people take. I have in the background here that it really in itself is not a disease. It's really a symptom of something else going on. So what we have to keep in mind that in men and in women to get excited, to get the penis is excited in terms of blood flowing in, to get the clitoris excited in terms of blood flowing in. You've got the vessels have to be able to dilate to allow the blood to flow in. And that means the rest of the vessels in the body have to be healthy. And so the vessels in those areas, of course, are very, very small. The larger vessels, the body is much, much smarter than we think it is. And so the body says, you know what, I need blood flowing to my heart. I need blood flowing to my brain. I know blood flowing to my lungs, different places. So it may be that something is wrong with our blood pressure. So I don't know if you can see in the back of me, a blood pressure monitor. So if you're having problems getting and maintaining an erection or clitoral orgasm, you should be seeing your primary care doctor. You should be getting your blood pressure checked, or you should be checking what blood pressure medications that you're on. You should be getting a physical exam, getting your heart, getting your lungs checked. So vital signs are very, very important, and those things should be looked at. So again, sometimes we focus on patients will come to see me, say I'm having problems getting and maintaining an erection, or just getting stimulation, or just feeling like I want to please my partner, but I can't. And it may be a problem with overall well-being, and not, they're focusing on their sexual components, but it really can go back to their overall well-being. So remember, think about seeing your primary care doctor first and getting your vital signs and everything checked out, getting an overall physical examination, because it may be pointing to a more serious health problem, okay? Maybe you've also had some type of surgery. I know all of you have been in some way involved with Dr. Callender and maybe different types of transplant surgeries or different things you've had done. It may or may not relate to something like that that's happened before. It may be secondary to, in the past, if you ever were a smoker, and hopefully you have stopped smoking, but smoking, and even nowadays people are vaping. We probably will see the effects of vaping in the future, but vaping still involves a certain amount of chemical, as we have in smoke, the tar, the nicotine, and everything that causes constriction of the blood vessels. Again, that constriction of those vessels decreases the amount of oxygen and flow of nutrients to the different parts of our body. It's going to affect the smaller vessels first. So the smaller vessels being the vessels that are in the organs, like in the penis, in the clitoral areas, in the vaginal areas. They're not going to get enough blood flow. If they don't get enough blood flow, they're not going to be able to maintain a satisfactory erection. So what is erectile dysfunction? It's the inability to maintain satisfactory erection to be able to satisfy your partner. So how it can be a perception, however one perceives that to be. Now, there can be different facets of that. There can be performance anxiety that can be involved, and there can be psychological issues, and one can cause the other, and vice versa. It could be also a matter of depression. So sometimes people have underlying depression that actually affects their ability to be sexually active. So it could be a nervous condition. Again, some patients that have had stroke, have history of Parkinson's disease, other neurologic factors, all those things can be affect your erections. So like I said, it's really, it's a signal. Like if you start to sneeze, if you start to cough, maybe you have pneumonia, maybe you have a cold, maybe you have COVID, but it's just something that's telling you that you need to look into it further, okay? So let me just go a little bit more so on the anatomy. And we're gonna start, I guess probably basics with men. I know there's some women out there also. The other thing I will say that a lot of times people don't think about it in terms of cancer, prostate cancer, the nerves that supply the penis for erections run alongside the prostate. So I have a model, I wish we were in person, but we're not. So, but I have a model in the anatomy of this is of men. We'll talk about men, then we'll go to women. Can you all see this? Okay, so here we have the phallus, the penis here. Let me see if I have a pen. Okay, in the scrotum.
I can see it very well.
Oh, great. Okay.
You raise it up. I think you raise it up. Yeah, that's better.
About there? Okay.
So, yeah,
that's
okay.
better.
That's better. Yeah.
Right there. Okay. So, excuse me, the phallus, the penis, which actually, couple things. The urine comes through, and also when you ejaculate, excuse me, through the urethra, the semen comes through. In that semen is the sperm, which are made in the testes, which is found in the scrotum or the sac. So down here, and they're carried up by the structure here called the vas deferens, which mixes with the fluid here from the prostate gland, and then it's ejaculated out, okay? So the nerves that go to the penis for erections actually are inside the pelvis. Certainly there are nerves on the outside of the penis for sensual stimulation, but the nerves that are important for erections are inside your body, inside the pelvis, and run alongside the prostate gland. So if there's anything that involves the prostate gland, infection, inflammation, cancer, enlargement of the prostate, and affects that neurovascular bundle, that can affect your erections. So I have seen, and Dr. Aaron Jackson, who was chair of urology kind of many moons ago, but not too long ago, sometimes erectile dysfunction can be a beginning symptom suggestive sometimes of some type of prostate disorder and even prostate cancer, okay? Or if you've had prostate surgery or anything, that can also be a signal, again, that we need to do not just treat you for prostate for your erections, but check out your prostate to see what's going on there. All right, so let's look at the penis. This is actually a model that Dr. Jackson left for me, gave me a long time ago before he left this earth. But it shows, I'm going to use it actually to demonstrate something else. But what I want to show you on here, on this model, is that in the penis, there are actually three corporal bodies. So we have here the glands or the head of the penis. Underneath, you see this, I don't know if you can tell, it's the yellow tube. That's where the urine would come out, so make it yellow. And then on the top, there's usually a pretty prominent vessel, superficial vein on the top of the penis. And then we have these other bodies, the corporal bodies, they're large veins, basically. And the medical term is body, like it's a corpus. So the corporal bodies where blood flows in, and that blood is the blood that flows in that causes the erection. So when the blood flows into the corporal bodies, and at least about 7 times the normal amount of blood that is in these corporal bodies flows in for the erection. So you can remember 7 times the normal amount of blood flows in. So these vessels have to be in good shape for that blood to be able to flow in. And when it flows in there, it has to flow in, and then it has to stay in those corporal bodies. The glands at the head of the penis, you can see the corporal bodies flow in a little bit to the mid glands, but it's actually the shaft that's actually getting erect, and then the glands superficially then becomes erect. The urethral area actually just sort of rides with it. It doesn't actually maintain its erection, but you might, when you wake up in the morning, guys, you might say, sometimes we'll ask you, do you wake up in the morning with, quote, a hard-on? So once you urinate, the hard-on might go away. Or at night when you're sleeping, especially when you're dreaming, you're in REM sleep, you may have erections, or you may even ejaculate. Little babies, when they're sleeping, they're actually having erections. And it's important when they're dreaming, because if they're not circumcised, it actually helps to push that phimotic, or that skin that is tight around the head of the penis, to open it up, so that if they're not circumcised, eventually that skin will become loose so that it can be able to be pulled back to clean the area. So there are a lot of different reasons for having really good sleep, being in REM sleep and dreaming, and off and on actually having erections while you're sleeping. Now, I wanted to show you this anatomy because it's going to be important when we start to talk about treatment for erectile dysfunction in men, okay? All right, so that's important there. So let's move on to that a little bit. Any questions so far? Okay. So one of the common treatments, probably the first line of treatment for erectile dysfunction. So let's say you've come in, I'll ask the students, okay, how do you treat something? How do you treat a particular ailment? And people will start jumping into laboratory values, this, that, and everything else. It says, can you turn off the blur in the back of your screen? Okay. Mariani, come for a second. I can try to turn off the glare. 1 second. I'm going to keep going. They want me to turn off the glare in the back, because maybe it's going with me. I'm going to keep going while she does that for me. I have my assistant here, one of our first year residents. He wants when to turn off the school. Yeah. All right. Okay, is that a little bit better?
Yes.
Okay, great. Okay. So I always ask, how do you treat a certain condition? And people say, you do this, you do that. Well, the first thing for treating any condition is to get the history. So we have to talk to our patients to get the history. What's your history? You know, did you smoke? Did you drink? Did you have surgery? Are you on certain medications? All these things are important. What's your physical exam? Then what's your lab work? And then we'll get down to treatment. Okay, so let's talk about treatment. So the first option in treatment for erectile dysfunction is, after we looked at everything else and deciphered everything else, is medications. So common medications are phosphodiesterase inhibitors. So the most common one that came out on the market first was, and I'll use the brand names and the generic names, was Viagra, okay? So Viagra, and there's actually 4 different oral medications to treat erectile dysfunction. And I will say, ladies, that these medicines were tried also in women, but they weren't. Treatment of ED in women is a little bit more complex than just taking a pill, but they were effective. They do increase blood flow. So how were they developed? Well, they were first looked at for blood pressure. They were being studied to help to see if they actually do help to open up the vessels, to dilate the vessels. And so the men in the studies were taking them, and it was lowering their blood pressure, and they were also waking up in the morning with an erection. And so they were very happy about that, and they were wondering, well, why was this happening? So we went back and studied it, and they found that these medications were vasodilators. They actually have a very common property, very much associated to caffeine. Caffeine actually is also a stimulant, is also somewhat of a vasodilator. And they also have a very unique sort of chemical look as yohimbine. So again, 20, 30, 40 years ago, we used to use yohimbine, which is a bark from an African plant, to, again, it was given to help with erections, but it's not really very, very specific for erections, but it can help a little bit. So anyway, as time evolved, Viagra was eventually developed. And what we found that it works in a chemical reaction inside of the cells of the penis, that once this chemical reaction starts, it helps to release the nitric oxide. And I tell my students, remember that instead of it's not nitrous, but it's nitric oxide. I say, we think about this as a person who's performing a particular trick for sexual satisfaction. And remember, so it's a trick, it's a nitric oxide. This nitric oxide causes vasodilation. That vasodilation, as I remember I told you, helps to increase that 7 times the amount of blood flow into these corporal bodies. Once those bodies open up, that blood flows in, the penis becomes erect, and therefore then you have your erection. Now, the blood has to stay in there inside of those sinusoidal bodies. We're not quite sure. The compression probably helps it maintain, but that's what's happening. So the nitric oxide, now the nitric oxide has to be inside of the penis. So you may have some people that market and they say, oh, take this nitric oxide, it's helping with your erections. Well, no, then when you take that orally, that's not going to get down to the cells and to the penis. It has to be inside. The reaction has to take place inside the cells of the penis. So you cannot just take nitric oxide over the counter and that's going to help you with your erections. That's really kind of false advertising, false marketing. There's a lot of false marketing that goes on. There's a lot of, you might, if you're up at night in particular, I think they do that potentially at people who are up at night and can't sleep, but they do a lot of false advertising. And if you actually buy the pill that they say is going to help stimulate whatever, it will say on the bottle, you read the entire bottle, say this medication, this pill, this whatever, this nutrient, this supplement, it's not intended to treat, cure, or diagnose any condition. You're basically taking it as a high plus supplement of vitamin. So it may help some things, but it's really over time, it's really a placebo effect. It's not really helping you over the long term. But anyway, and the other thing to keep in mind is these medications like Viagra, there's 4 of them. So there's Viagra, brand name is, generic name is sildenafil, there's Cialis, Levitra, and another one called Stendra that just came in the market. And they're all in the same family as phosphodiesterase inhibitors. And they all work a little bit differently, and they all have a little bit different side effects because they work a little bit differently. But basically the way they're working is that once the sexual stimulation, so that has to happen first. How can that happen? Foreplay, masturbation, visualization, auditory stimulation, whatever, that has to happen first. And then once that chemical reaction starts to happen inside of the cells of the penis, and then nitric oxide is released, the vasodilation occurs, the blood flows in, and then the erection occurs. After that, the activity occurs and the orgasm happens, the ejaculation happens, then the erection goes down. Now, with the different medications, Viagra basically stays in the system about 24 hours or so, and then it's metabolized, and then it's once it's broken down, the components is broken down, it's then it's out of your system. Cialis, though, or Tadala with a T, tadalafil, can last a little bit longer. It can last anywhere between 24 to 72 hours. So sometimes it was called the weekend medication for erections, because once you take one pill, not that your erection will last 24 to 72 hours, but it can be broken down and then it can be sort of recalled again with sexual stimulation, and then it can be used again. So it has a little bit of more of a longer acting in your system to be used again. But the thing about it, also can have longer acting side effects in that if you have, for example, other issues with your heart and you're taking other medications that also lower your blood pressure, you have to be worried that those side effects the 2 of them can have side effects. Levitra is similar to Viagra in that it has a 24-hour sort of window. And then the last one, Stendra, it's sort of claim to fame as that it can be taken with a little bit more of alcohol or food. So one thing that was learned with Viagra and Cialis and Levitra is that they probably should be taken on an empty stomach. When you take them, especially with a high carbohydrate meal or alcohol, it interferes with their metabolism, so they don't work as well. And So Stinger was developed that you can take it with a little bit more than 6 ounces of alcohol or food, and so it works a bit better. So in developing the different medications, that's how they came about. Not many people know about Stinger, the last one, because it's the last one on the market, so it didn't get a lot of different play in terms of it being developed and being used, but it is also available. Now, what I will tell you with these oral medications, that they're not 100% on everyone. They only really work on about 2 out of 3 people. And they also don't work very well in patients that have diabetes. Diabetes is itself a disease that also works on the smooth muscles and vessels inside the body. And they themselves also sort of kind of cause havoc, and the medications don't work as well. So, but we do have other alternative treatments for patients that have diabetes mellitus and other different conditions. So with Viagra, it has potential side effect to that particular medication. These phosphodiesterase receptors are found other places, for example, in our eyes. And so Viagra has a side effect on the eyes that it can cause in 10%, not everybody, a blue tint to the vision. And so it is on the list of medications that pilots should not be taking it. People, who are driving the plane within an hour, because it can cause this blue tint. And of course, we wouldn't want them up there flying with a blue tint to their vision and trying to navigate the sky. So it's on the sort of bad list of medications for pilots, but there are other medicines that they can take. Cialis, as a side effect, has 2 actually. One is a good side effect that also, as it can lower the blood pressure to some degree, it also has a little bit of what we call alpha blocker activity. So if you have also signs of BPH or benign prostate enlargement, it can also help you with bladder outlet obstruction. So instead of being on other alpha blockers, some of you are on things like Flomax or tamsulosin, where you need something to help you with emptying your bladder. Cialis is also FDA approved, not only for erectile dysfunction, but in lower dosage, daily dosage is also approved, indicated for BPH. But it can also cause some muscle weakness in the legs and some muscle pain, usually not enough for people to stop taking the medication, but just kind of be aware of that. That is a side effect of that medication. Levitra, again, will be similar to Viagra, and Stinger, not very similar to the other medications. But so that's just in general, if you decide to take any of those medications. The main thing is, if you do have problems with your heart and you are on other medicines, particularly nitrates and nitroglycerins, that also lower the blood pressure, they're vasodilators, you do not want to take the Viagra and the Cialis with these medications together, because your blood pressure can get too low. You can get lightheaded, dizzy, faint, and have untoward consequences from that. So initially, when Viagra was marketed, that was known, but it wasn't really. It wasn't, a lot of that wasn't told to patients, and it was marketed more initially to nonagenarians, octogenarians, and people were dying from having sex but taking their nitroglycerin because their blood pressures and things were getting too low with those medications. So they are contraindicated to take both of them together. And that's probably the more worrisome thing with Cialis, because it is such longer acting. And so if you're taking Cialis and you're using nitroglycerin too, the two of them are contraindicated, taking them together. The other thing that we're concerned about is priapism. And of course, you'll hear the commercial when they used to advertise all the time. It's an erection that lasts more than 4 hours. Now, this is not a normal erection. This is actually an abnormal erection. So this is when the blood is actually sort of in the penis, not draining out. It's in there too long. And actually, that blood is not oxygenated blood. It's now blood that does not have oxygen in it. It's bad blood. Sometimes we see this very commonly in patients that have sickle cell disease in the trait. And it actually then, this deoxygenated blood actually causes harm to the cells and actually can cause glucosis and death to the cells. So if you have an erection that's lasting, it should go down after your orgasm and ejaculation. If it doesn't, and it tends to last more than 4 hours, well, a couple things you can do at home. Stop the stimulation. First thing, put an ice pack on. Second thing, you can use pseudoephedrine Sometimes that'll work. If not, you need to come right into the emergency room, call your doctor, come to the emergency room, and then we have different techniques that we can use to take that erection down. So that's probably the worst side effect from the oral medications and other treatments I'm going to talk about. So any questions so far on oral therapy? Okay, so that would be the first most common therapy that probably your doctor, urologist will talk to you about. Yes, yes, sir. Did I see a hand waving? No.
I have a question.
Yes, sir.
You mentioned about blood pressure.
Mm-hmm.
So, is there a range of blood pressure that we should check for when we take our pressure at home?
Yeah, that's a good question. So I see you have a watch on there. So there are a lot of smart watches now that, and which is nice that they're available for a couple of reasons, that you can use the regular blood pressure cuff or blood pressure machine to take your blood pressure. Now, I am not a cardiologist, but I am a physician. And so you want to really address that question more to your primary care doctor and your cardiologist, because the blood pressure ranges actually have changed. Okay. And some of them are actually more towards your own blood pressure. But in general, we used to say, 140/80 or something. But now physicians are looking to having lower blood pressures in the 120 range. Now that, like I said, depends on you, because some patients, when you get the blood pressure down too low, it may be too low for that particular patient, okay? If you have a smartwatch on, you can actually monitor your blood pressure during the day. You can see what your blood pressure, your pulse, even your EKG, even your oxygen saturation. And I think this is really a nice idea, because when patients come into the office to see their doctor, sometimes they'll come in and their blood pressure is high, and they'll say, well, I have white coat syndrome. My pressure goes up since I come in a physician's office. But if you have the smart watch and you say, these are my pressures at home, and you can show them to your doctor, it's really nice, because they can say, oh, okay, so those are your blood pressures at home. And maybe when you come in to see me, you do have, quote, white coat syndrome, and I can see where you are and compare to where you are. So I think some of these smart watches and things are actually a good tool to have to be able to speak to your doctor with. But I will say the whole blood pressure phenomenon and everything, you should really speak with your primary care doctor. Certainly if you're over 140, in terms of your top number, your systolic number, that can be somewhat worrisome nowadays, when before it used to be thought, oh, that's okay. That may not be okay, depending upon your overall physical health.
And on that same topic, my doctor, when I told him I was having issues, he actually changed my blood pressure medication.
Mm-hmm.
And I don't know if it's really working yet, but he said that certain blood pressure medications can definitely affect your ability to have an erection.
Yes, that's very true, because those blood pressure medications are to lower your blood pressure. Okay, so when they lower your blood pressure, that's going to lower the pressure of the blood that you need to have the blood to flow into your penis for your erections. But keep in mind, the key there is to keep the blood pressure low. So I'm going to show you some other options for treatments to help maintain your erections. Okay, so we want to keep a good pressure level for the brain function, for the heart function, for everything else to go on. And then we'll work around that in terms of quality of life, in terms of your sexual function. Okay, but yes. And as I mentioned, with the medication is like Viagra, and I just picked Viagra. I have no stock in Viagra or Pfizer, but and maybe some of you might have it in your portfolios. A lot of people do probably, but you don't want your blood pressure to drop so low that when you do take a medication like Viagra or Cialis or something, that it also is a vasodilator. As I mentioned, remember, it was initially touted to lower blood pressure for hypertension. And some people do give it, it's under a different name. Not Viagra has a different name when it's used for pulmonary hypertension. It is used for that. You don't want your pressure to drop so low. Okay, so it's one of those things when I have sometimes patients will come in, they'll say, oh, by the way, I want to, medicine for my sex life. It's not really a by the way conversation. You should bring it up with your doctor immediately. If when you're talking about, okay, yes, doc, thanks for the medicines for my blood pressure, but I also have an issue with my sex life. And now they may not have time to talk about it on that particular office visit, or they may say, well, let me refer you to my favorite urologist and he or she will talk to you about it. But it's not like, okay, yeah, here's a prescription for this. It's something that really needs to be discussed because there can be different interactions with these medications and everything. Okay, yes, Atto, is that Dr. Atto? I see your hand up. Go ahead. I think you're still on mute.
Still muted.
Unmute yourself. You're still muted, Dr. Atto. Let's see if I can. Okay, go ahead.
All right, thank you.
Mhm.
I have just two questions. One, this incidence of erectile dysfunction, I can I assume that it increases with age? One, and then secondly, these various treatment options that you gave, like Viagra, Cialis, I will assume that the digestive enzymes, have some effect on their acting. And if so, is there any other form of treatment for ED, such as an IV or just ordinary rub? Has there been any advances made, to bring about the treatment of ED through IV intravenous treatment or through just an ordinary a rub, like just ordinary rub on the penis?
Okay, yes. So there are other advances, even in these medications. So these are oral medications that you can take at home. You don't have to give an IV therapy for them. I mean, there are some, even in these medications, advances are being looked at in terms of just not an oral tablet you swallow, but I know for Cialis, they're actually also looking at it as a chewable tablet, because sometimes not everyone can swallow certain tablets. That will probably come out in the next couple of years. There's also looking at a salve that, like you said, that you would maybe rub onto directly onto the skin. We know the skin is like the largest organ in the body for absorbing things correctly. So they have looked at different salves for rubbing on directly onto the area of the skin of the penis in terms of absorption that directly that way.
Mm-hmm.
And so there's some new treatment options that are going to come out.
Okay.
Intravenously, that's not one that, one probably would want to consider. But as I mentioned, they do, when you take it orally, they do go into the system. They can also have interference with metabolism of other things that you may eat or drink with them.
Yes.
And that can delay their absorption or their ability to be effective with other things that you eat or drink with them. So they should, for the most part, they should be taken on an empty stomach at this point in time. Or a minimum of 4 to 6 ounces. So I know a lot of times maybe Valentine's Day came up, people are having some wine, something like that with their meal, but you have to make sure that they are taken probably after 2 hours of drinking or after having a high carbohydrate meal. So on that note, unless you have a follow-up question, I'm going to go on to some other options for treatment besides the oral medications, because as I mentioned, not everyone is going to respond to Viagra or Cialis or Levitra. So there are other options, and all of them are going to be involving trying to increase blood flow into the penis. Okay? Is that good for you, Dr. Atto?
Yes, very good. Yes, thank you.
You're welcome. Okay. So some of the other options, again, trying to stimulate the corpora, trying to increase blood flow into this corpora cavernosa, is direct stimulation. And so this is, there are 2 companies that make, it's called, one is Caverjet and one is called Edex. And it's a small needle, it's small, it's about 35 gauge, it's smaller than an acupuncture needle. And it's actually smaller than a needle that you would give if you had insulin diabetes, that you would be taught how to inject directly into the corpora cavernosa, okay? So let's go back to our anatomy. So remember I was saying about you have the glands or the head of the penis, you have the shaft, you have usually that superficial vein. There may be many on the top, but there's usually one sort of big vein. And then on the bottom of the penis is the urine tube, okay? So this is injected not into the vein directly or not underneath the penis, but into the shaft of the penis, into the corporal area. So, and not into the head of the penis. So you would be taught how to inject this medication. And you can see the needle is maybe less than a centimeter, like an inch or so. It can come with a injector gun where once you swab the skin with an alcohol swab, you just put it there and you just tap really quickly. So go really quickly down into the corpora and inject the medication inside the corpora. And the medicine is alpostadil to begin with. So that medication is a vasodilator. It will dilate the vessel, this main vessel, which communicates with both the other side of your penis to draw that blood, to dilate the vessel, draw the blood into the penis and cause the erection, okay? There's a way that once we decide how much you need for your erection, we can dial that in. It can be 1, it could be 2 millimeters, there's a certain amount that we can figure out what you need for your erection type. This one here is set at 1.5, this one here is set at 2.5, so there's different amounts. We usually do a test dose in the office. Now, what I will say with this one injection of the alpostadil, sometimes if that's not enough, we can add in 2 other medications to enhance the erection. With this type of injection therapy, however, because now you're injecting medicine, now so you're not taking it orally, it doesn't have to get metabolized in your system, you're directly injecting. This is probably the most common way that if you over-inject, that you can get priapism, okay? So that's why we have to titrate how much you're gonna need before you go home. Also, you're gonna be using a needle to inject with. This is not a real needle, this is just a sample one that I have here. But you're gonna need to learn how to use it and then also how to dispose of this. Once you do inject it, then you can't use it a second time. You have to get a different one of these syringes to use it again. But it's very effective. The one thing about this, you don't have to have any stimulation beforehand, foreplay or anything like that. You just inject the medication directly in, and 90% of people respond to this type of treatment. So not like the other oral medications where about 66% of people will respond, 90% of people should respond to this. But you have to learn how to use it. There maybe is minimal pain at the injection site. You have to actually rotate your injection sites. You don't want to go in the same site all the time, so you don't build up scar tissue in that area. And those are probably the main sort of side effects I see with this type of treatment. Okay. Now, there's another one. It's a transurethral system of putting in the same medication, the alpostadil. This type of medication, though, does have to be kept in refrigerator. So it has to be kept at 36 to 46 degrees of Fahrenheit temperature. Otherwise, it decomposes. So you have to keep this in refrigerator. So if you're traveling with it, you have to keep it on ice and everything. So that's a little bit of a drawback. But it comes in a container like this. This again is just a sample. Let me just, 1 second. Anyway, so it's going to come in a package like this. You tear off the package, you open it up. Like this, you take it out of its sort of container. The medication, it looks like a little piece of rice, but it's found in the bottom of here. So the way it works, it's going to have the alpostadil inside of this little pellet. Some people call it a pellet or intra-urethral suppository. So it's going to go inside of your urethra. So when you put this in, you want to first urinate so that you don't put it in and then have to urinate, because if you urinate, once it's in, you're going to wash it right out. So you urinate first. The urine that is left inside your urethra becomes the lubricant. So you don't want to use Vaseline or any other type of lubricant with it, because the Vaseline or whatever will sort of jam up this opening, but just your regular urine. you kind of just put this down. It has to go down to this hub here, so it reaches those corporal bodies, okay? So you want to go down to about there. Then there's a plunger that you push, and that pushes the little pellet into your urethra, into where these corporal bodies are. So once that medication gets into where the corporal bodies are, you just gently massage your penis for about 10 seconds. And the warmth or the heat of your own body causes the pellet to dissolve across into these corporal bodies. The medicine then gets absorbed into the corporal bodies, and then it stimulates those bodies to dilate and allow the blood to flow into the penis for your erection. So this is, and it's right now only one company makes it, Muse, M-U-S-E, but there is a transurethral or intraurethral suppository or pellet for your erections. It comes different dosages from, and they're micrograms. So from 100 micrograms up to 1,000 micrograms. So again, you have to be titrated up. Most people have around 250 to 500. Some patients are on 1,000 micrograms. Now, I will say that in general, you try each of these doses, each of these different treatments separately. I don't think I have anyone who's doing all three, treatments. You either try the Viagra, see how that works. You try the intraurethral suppositories to see how that works, and then the injection, intracorporal injection, see how that works. We don't, because if you try them all at the same time, you're going to run the risk of getting priapism. And I will tell you, if you have to come into the hospital for priapism and we have to take your erection down, that's not a very comfortable feeling. We actually have to put a needle in the penis and draw that, incorporated that sort of clogged blood out of your penis. That's not very comfortable. So you don't want to try to mix all these things at home one at a time. Okay, so we have the oral treatment, we have the injection therapy, we have the intraurethral pellet or suppository therapy. And then we also have something called the vacuum pump device. How's everybody doing? Moving along okay? Yes, John. We're good? Okay. Okay.
Very good.
Okay, great. I see you have like a little teaching classroom there. Okay. So now this vacuum pump is just that. So what you're going to do, I'm going to use this for demonstration. Okay, we put where you can see. Basically what you're doing, you're creating a vacuum or a suction. That vacuum or suction is going to draw the blood. So everything is about blood flow. That's why I say at the beginning, it's so important to get your blood pressure checked and your everything that really hinges on blood flow into the penis. So you're going to create this vacuum. So this suction device here, you're going to create this vacuum that's going to draw blood into the penis. When that blood gets drawn into the penis, into the corporal areas, there's a particular type of band. So this is not a rubber band, but it's a special band that would then come onto the base of the penis to hold that blood into the penis. And then we'll keep that blood in the penis and keep the penis erect for sexual activity. And then once you finish, the band then slides right off. So I tell patients, this is not a rubber band. You do not want to put a rubber band on the base of your penis because that's going to potentially strangulate your penis. Sometimes we give patients bands that they can use separately. I'm sorry, I don't have one to show you here, but you can sometimes, if you can get an erection on your own without the vacuum suction, there's a special band that you can then put at the base of your penis, and then that will hold the blood in the penis, and then you can go ahead and have sexual activity. But if you need the suction device to get the blood to flow in, then you use the special band. And these are actually they're soft and very comfortable. There's a lubricating jelly that comes with it to help it to slide on, okay? Now you're thinking like all of this, yes, it seems like a lot. You can learn how to do it. I have a patient about 20 years ago, I did a radical prostatectomy on that had postoperative erectile dysfunction. And he's been using the vacuum erectile device for the last 20 years. And he's able to do this within, I don't know, 5 minutes or something, and he's ready to go. And this is what he's used for the last 20 years. Yes, it has. There's a little bit more you have to learn how to use, to get used to using, or your partner can even help you with using that too. But it doesn't involve having to inject any medications or take any medications or any side effects of medications. And you can get a very adequate erection using the vacuum pump device. Okay. And they come different. So this one here, actually, you have to use a pump I don't know if you can hear that noise, to actually create the suction to draw the blood in. And then there's also one that is an electric that you push the button that creates the suction to draw the blood in to create the vacuum. And then finally we have, now this is not, and I'm showing these, there's not necessarily the order that you have to go in. Sometimes some patients will come in the office and they'll say, you know, I've tried Viagra, I don't like the side effects, I want to go straight to the needle injection. Or they'll come in the office and they say, I want to go straight to placement of a penile implant. So a penile implant or penile prosthesis or an internal pump is what I'm going to show you next. You don't have to try everything first before you get to the implant or the vacuum pump or whatever, but I do like people to understand the different alternatives before they go to a surgical option. Because once you decide that you want to have an actual penile implant placed, the penile implant, once it's placed, now I'm going to show you what those look like. It's actually going to now take the place of the corporal tissue that you had inside. So here is an example. There are basically two types of implants. This is just one side of an implant. So remember I showed you inside of your penis, you actually have two corporal bodies where blood flows in for erections. You have one on the right side and you have one on the left side. So that's where the penile implant cylinder would go, one on the right and one on the left. Once those implant cylinders go in, whatever erectile tissue you had in there, this implant cylinder now is going to take the place of that erectile tissue. So one will be on the right and then one would go on the left, okay? This type of implant, these cylinders, and they're not the same length because when we put this type of cylinder in you, we have to measure you for the length that's going to fit your penis. They are different lengths to different penises, so not everyone has the same length. So we wouldn't want to put a long one in the short penis and vice versa. But there's one on each side. This is called a malleable. Malleable means that there's always some erection to it. The way it works is that when you have two in, the penis is very erect with it. And so you would bend it down into your shorts or underwear, and then you would bend it up when you want to be active, okay? So this is the malleable. And then we have the pump type. This is when I wish we were like in person so you could really see these, but then we have the pump type. Again, you have two cylinders. So one cylinder in each corporal body, one on the right, one on the left, that are filled with water from a reservoir. And all this is put inside you. Nothing is will be seen on the outside. Everything is put inside your penis and underneath the muscle of your lower abdomen. And this little pump device is put inside your sac, not in the area where your testicles and your testes, actually your testes are, but underneath the skin of your scrotum before you get to your testes, okay? And so I have just water in these now, but I have just air in these now, but they would be filled with water. The water would be in this reservoir. And once you would squeeze this pump, the water would come from the reservoir and then it would fill the cylinders. And the water in the cylinders would then cause your penis to become erect. And then once your penis is erect to the capacity you want, and the amount of water in here is about 5 cups. You're probably only going to need about 2 cups to actually fill the cylinders or less, but we give you extra. And once the cylinders are filled, then your penis is erect. You have sexual activity. And then when you're finished, then there's like another little valve that you push, and then the cylinders deflate, and then your penis is flaccid again. So this is called a multi-component because there's more than just the cylinders. You have multiple components. You have a reservoir, you have a pump device, and all this is put inside so that you can sort of more simulate the usual response, how things would, nothing is ever like Mother Nature, of course, has built it, but to sort of stimulate that in terms of getting an erection. So these would be, this would be the malleable placement for your penile implant, and then this would be the multi-component penile implant. So these are the things that are FDA approved for treatment of erectile dysfunction. Now, there are other things, and I don't have them here, but there's some other things that you might see on the market. And I'll just mention one for to help with erectile dysfunction. And I think the latest one that I've seen is using ultrasound to stimulate blood flow. So there's using an ultrasound. I don't know if any of you have ever had an ultrasound, but I'll just say, just think of this lubricating jelly here as an ultrasound probe. The ultrasound probe, and I'll just use this penis, is jelly is put on the skin, and the ultrasound probe is used to sort of like massage the penis. And so in that massaging, what is thought to be happening is that it's causing the vessels to dilate. And again, when they dilate, blood will flow into the penis. So different marketing firms that are out there will market this to you or to people and say, well, come in and have this ultrasound technique done. And they'll give you like your first sort of ultrasound technique free. And then the next, you set up a schedule of 2 or 3 demonstrations. It's about $600 to $1,200, and actually even higher to have this done. It's not FDA approved. Why? Because there are not enough studies to show if this is really working. If it's not, again, just a placebo effect of someone of a nice massage, and that's causing the flow of penis and blood into the penis. And is this a long-lasting effect? As someone had mentioned about different lubrication, different swabs and into the penis, rubbing onto the penis. Again, yes, you can create the massaging action can stimulate blood flow, just like if you ever have a massage and someone uses a warm cream, that again will heat up the flow of blood and give a nice massage. But then is that a long-lasting effect to maintain an erection? So there are other places that will advertise different techniques, different things for erections, and they sound good and they may work, and but you pay your hard-earned money to go and find out about them. But then the things I've shown you today are things that are FDA approved, and they have been tried and tested and work. Not everything, nothing here is 100%. Even the placement of the penile implants can have, things can happen, things can go awry. For example, infections, we have to take them out. The tubing sometimes can get kinked. If your body weight changes 20, 30 pounds, you gain 100 pounds, you lose 100 pounds. A lot of different things can happen. We have to change those around. So nothing is 100%. I see Dr. Callender's hand is up. Yes, Dr. Callender, let me unmute you.
The only issue that I would raise is that what about those commercials on television that talk about testosterone levels? And are those really effective, or are those just advertisements?
Right. Thank you, Dr. Callender. So testosterone is hormone that is made in men and women, actually, but predominantly in men, it's 90% is made by your testes, another 10% by your adrenal gland. Now, testosterone is primarily important for your libido, for your sex drive. So it's also important for your male organs to stimulate your penis and your prostate growth, but it's actually not FDA approved for treatment of erectile dysfunction, okay? With respect to getting an erection. You do need testosterone to have overall sex drive, but you don't necessarily need it for your erections. Testosterone itself, so you'll see that they were doing a lot of advertising for testosterone, but you notice that it stopped. Why? Because testosterone, when it's given properly, actually has a lot of side effects. Testosterone can cause blood clots. It can cause pulmonary blood clots in the lungs, blood clots in the legs. It can increase make your red blood cells thicker, which causes this. It can cause problems with your thyroid function test. It has a lot of side effects. So it's something that, and when I say when given properly, so when it's actually given as either as a gel, as an injection, different ways. When you get testosterone, you just take it as a pill, you really don't absorb that much of it. Or if you see it like over the counter, it says, oh, this is testosterone, it's really not enough to really do anything. So it's as a supplement, it's really, again, a waste of money when you take it that way. But again, the FDA has asked these companies to stop marketing it because it really can be a very harmful drug taken that way. Yes, Dr. Callender?
Yes, the other question is, what about for the women in the audience who have
Yes, we're going to do
decreases in libido? And
yes.
What about them?
So testosterone actually has been looked at for women. A small amount of testosterone now is FDA approved for women to help with their sex drive and their libido, and also for stimulation in the clitoral area. But there's a small amount that's regulated for women to be used in that respect. And there's a lot of research going on for women, for us, in terms of our sex drive. One thing that we do know that the vaginal area is very hormonally dependent, and what hormone is it dependent on for us is estrogen. And so as we get older, and for men, your testosterone level goes down, a little bit of your estrogen level goes up, and women, our estrogen level goes down, not much of our testosterone level goes up. But we lose some of our estrogen level in the vagina, which is where we need it to keep the vagina nicely moist and lubricated for sexual activity. So there are ways to replace the estrogen level to the vagina, not by pill, not orally. It gets into the system, but it doesn't get down to the vagina. So the way to replace estrogen vaginally, there's actually 3 ways. One is using a small amount of estrogen vaginal cream. You prime the system, you put it in at night. Hopefully you're not going to the bathroom much at night, so you're not rubbing it off. You put it in at night, small amount of estrogen vaginal cream, about 1 gram or a fingertip amount around the area, the external vagina, will get absorbed in. Or there's an estrogen pill that can be put in, a small pellet, or an estrogen ring that can be put in once every 3 months, and it will deliver estrogen to the vaginal area for vaginal atrophy or atrophic vaginitis. So you might be wondering, oh, well, but am I going to be getting estrogen and I have to worry about breast cancer or endometrial cancer? The amount of estrogen that's given this way is a small amount. It doesn't get into the systemic absorption. So sometimes even patients that have had a history of breast cancer, if it's not estrogen receptor positive, can use this type of estrogen replacement because it's very, very minimal systemic estrogen absorption. So that's something that can be for women for estrogen replacement for atrophic vaginitis. Let's see, any other questions? I know we're about out of time.
Is there anything you don't know about the genital urinary tract?
That I don't know. Oh, there's so much. And there's so much education now coming on for women. And there's a lot of things that are coming out more for men too. Like I said, there's going to be some changes in how the medications are going to be delivered in terms of chewable forms and other things. And we have different types of newer implants. And I mean, there's a lot of things. So I would just say to leave you with that erectile dysfunction or changes in our erections, changes in our bodies are things that are going to happen as we're people living older. I have a patient that came in last week, 107 years old or young, how he wants to put it. And so, so there's a lot going on, a lot of interesting research. Yes, Dr. Otto?
Yes.
Yes.
Yes. Again, thank you for a very good presentation. From your experience, would you say that men over 75 years old, come to your clinic or to your hospital for ED treatment than younger males, like in the ages of between 30 and 50? On the average, will you say from your experience that older men had come for ED treatment
Oh, okay. Yes, good question. I would say, first of all, men of all ages come. So it's not just, again, it's not just not just men of older age. Okay.
Okay.
In general, though, when I do see men in the younger age, in their 30s, say let's say 25 to 40, I do have to think about other, I think actually more of, is this a sign of, especially in African-American men, of beginning hypertension? Because they are focusing on, or high lipid levels. Their cholesterol is high, their blood pressure is high, or thyroid disease or something else going on. And, or is this a transient, phenomenon? So what I will do, or sugar, because they actually are presenting with something else. And a lot of times they're presenting with high lipid levels and hypertension. And I see them presenting with high blood pressure in their 30s, and they're presenting with the erectile dysfunction, but they're actually coming on with hypertension. So that's one thing. So I get focused. I talk to them about what they're seeing with their erections, but I really want them to understand we need to get your cholesterol level. And a lot of times they have high cholesterol. And then we see them in their 40s and 50s, if they don't get that checked, having a stroke. So I want them to, so I'm happy that they come in, because it gives me an opportunity to talk to them about other, other factors, other health issues that they need to be talking about. But I will say, for the most part, in my practice, in my clinic, I am seeing men probably in their 50s, 60s, because I'm seeing them for more problems, issues with enlarged prostate or symptoms of maybe elevated prostate, PSA blood tests and things like that.
Okay.
And then with that, I don't let people walk out and say, by the way, I try to bring up the issue of erectile dysfunction so we can have a healthy conversation about that, and not as a by the way conversation. So I like to get into it early, not later, and move on from there.
Thank you.
Mm-hmm. Well, thank you, Dr. Callender, for inviting me. Thank you, everyone, for your attention. And as always, I'll be happy to come back and talk on any other subject, urologically.
Let me ask you one last question.
Yes.
What is your stance on whether African men above the age of 45 should get a PSA?
I think African men at 35 should get a PSA. Tell you the truth, I mean, just like as we've moved the dial for colon cancer to 35 in African-American men, I think that there should be a baseline PSA at least at 40 in African-American men. I'm starting because certainly at 40, certainly African-American men, whether or not they have a history of prostate cancer or not, should have a baseline PSA. That's my feeling.
Well, I must thank you for a fabulous presentation. And I think we're very happy that you present on a subject that most people are afraid to talk about. And you not only talked about it, you went into deep detail to tell us something that we wouldn't otherwise know about. And so I can't thank you enough. And we hope you'll be able to join us again sometime in the future to educate us and elucidate us in terms of how we can be our best selves.
There's
Thank
one
you.
more hand, Dr. Callender, one more hand.
Yes, sir. Thank you, Dr. Callender.
Dr. Coleman, I have a question about how a doctor can help a patient get affordable ED medications. And the reason why I say that is because generally they're not covered by prescription drug coverage. By some of the standard pharmacies like Walgreens or CVS, the price may be several $100s. Online drug sources like RexMD or Get Roman still may be, it's less, but it's still very expensive. Is there any way a doctor can help a patient get more affordable ED medications?
Yes, so thank you so much for that question. I should have meant to cover that too, because yes, there are. So quickly, so there's, I tell my patients about GoodRx. I actually have a sample, like on my phone, I'll show them how to use GoodRx. There are some pharmacies that are cheaper. Costco's, for example, you don't have to have a membership to use Costco's. It's much cheaper than CVS or Walgreens. And then we also use a company called We Care Pharmacy. Now you do have to buy in bulk. So let's say, for example, Viagra, and it is generic. You have to usually buy generic, although you can buy brand names. So generic for Viagra is sildenafil. You can get it as cheap as $2, $2 to $3 a pill, and it is the medication, because sometimes you can go on some of these websites and you're not getting the medication. You're getting some population of the medicine that has mostly sugars and salts and not the real medicine in it. But this We Care Pharmacy does have the sildenafil in it. They will also mix up the alprostadil and the try mix different things that we need. But you do have to usually buy 30 pills, but it's at $3 a pill or $2 a pill, it comes out to be $60, and you can get what you need. And so if you're having a problem with that, feel free to contact me or through Dr. Callender. My email is pamela.coleman@howard.edu. And I can get you the information you need to be able to do that, or anyone that needs to be able to do that.
And there's some sources for anybody that missed that, I think he said goodrx.com. Is that correct?
Yes, GoodRx. And actually GoodRx will show you, now you do need to have a prescription. So, you need to get a prescription from your doctor, and it will actually, if I go on GoodRx right now, I put in sildenafil 25 milligrams, 100 milligrams, it will give you the pharmacies near where you live. And it will say, for example, Safeway is $200, Costco is $50, and Rite Aid is, X number. And you can decide where you want to go. And it will also even give you a coupon that you can use when you go there. But you do need to have a prescription to take wherever you're going to get that medication. And you can use it for other medicines too. You can use it for your amlodipine, your Lasix. I mean, you can use it for other medications also. And also as a disclaimer, I have no financial support in any of these things, but I have given those to my patients to use. Yes.
Well, we can't thank you enough for your invaluable presentation.
Thank you very much.
Okay. All right, group. It's been a great session, and see you next week. Next week we're having a presentation by Dr. Beesis on medical problems of those people who are over 50. So those people who are 20 and 30, it will not apply to you, but those who are 50 and over will apply. So have a good weekend and see you next week.
And Dr. Callender, thank you.
Somebody had a question?
Chris? No, I was just saying good morning. Good morning. It's
Okay.
you all's topic this morning was informative.
Oh, yeah. Oh, we haven't seen you in a